American man who was horribly disfigured after a gun accident 15 years ago has emerged from behind his mask after the most extensive face transplant ever performed.
Richard Norris was 22 years old when he had an accident with a gun. He lost his nose, lips and front portion of his tongue. For 15 years he lived almost as a recluse, wearing a surgical mask and often only coming out at night. Now aged 37, Mr. Norris came round last week after 36 hours of surgery involving 150 doctors and nurses at the University of Maryland Shock Trauma Center, with a nose, a tongue, and he says now he has his life back. The operation involved reconstructing the whole midsection of Norris's face and transplanting sections of the face that could not be artificially reconstructed, like the lips, nose and large parts of the skin. Those parts came from one anonymous organ donor, whose other organs incidentally saved 5 more lives. The operation was the culmination of a decade's worth of research funded by the Office of Naval Research as part of an effort to help troops injured by makeshift bombs.
Well, earlier I spoke to the surgeon who led the transplant team, Eduardo Rodriguez, of the University of Maryland Medical Center. I started by asking him if there was a likelihood of Richard Norris looking like his donor.
The soft tissue of the nose will be exactly like the donor. The upper and lower lip is exactly like the donor, and the chin, soft tissues over the chin point are exactly like the donor. But when you look at the overall appearance of Mr. Richard Norris, he really is a unique blend of Richard and the donor, so it's the most amazing result.
It took you 36 hours with him, and that in itself is an enormous human endurance for a surgical team, and you were operating for 72 hours on all the people who received elements of the donor's face. Isn't that almost beyond any kind of normal surgical activity? I mean, it's extreme, isn't it?
When you really think about it, it took us 36 hours, but it's no different than any other surgery. We have a problem before us, we have a problem at hand, we have to solve that. Within the 72-hour period, 5 other organs were transplanted within our institution.
Given that he's been a recluse, isn't this going to be a vast undertaking to bring him back into the world he effectively forsook?
He was hiding behind a mask, didn't have normal employment. He did have social interactions, but not as you and I can define them. The psychological component is a very important one, and that's why Richard has a lot of support here at our institution as well as back home when he gets to go back. But one of the other larger components that we're constantly vigilant about and looking out for is the potential for rejection, to ensure that there is not going to be any potential tissue loss or rejection that could compromise this vascularized graft.
Do you have any anxiety about the donor's family? Because obviously there is now somebody who looks like somebody they loved and lost.
The family is aware that due to their gracious gift, 5 families were saved, and they understand this, and this has been handled so graciously by the Living Legacy Foundation, so I really don't have any major concern whatsoever.
Could it really become the norm? Could it be something that is applicable to, say, the 200 American soldiers who are thought possibly to be candidates for such an operation?
All of the centers, I'm sure, will continue to make this a better procedure, which will be more reliable and which will provide an opportunity to treat any of our wounded warriors at any capacity. The goal is to return patients to normalcy, restore not only their appearance, but more importantly, their function.
Eating normally, speaking normally, how near that goal is this particular patient?
Richard Norris right now is getting used to his new face. He's learning to open and close his mouth, which he's already doing. We currently have him on a liquid diet. We're not going to advance him to any solid food until we know that the intraoral incisions are well healed, that there will not be any possibility for contamination or infection. But we're still a long way. He's working with speech therapists. I certainly recognize that his speech gets a little bit better every day, but it's going to be a long road.